Hello, my name is Ann Berger, and I'm a professor and advanced practice nurse in oncology at the University of Nebraska Medical Center, College of Nursing. I'm very happy to be here talking about managing fatigue at the 2021 Cancer Survivorship Conference. Before we begin, I'd like to disclose that I have no conflicts of interest. However, I am the team captain for the National Comprehensive Cancer Network Guidelines Panel for cancer-related fatigue, and this is a voluntary position. I want to assure you that we have a chat box, and please use that to submit questions as I present, because we will have time at the end for questions and answers. So the learning objectives that I have developed for this presentation, I'm going to present now. The first one is to identify the role and responsibilities of clinical cancer providers in teaching patients and their caregivers about evidence-based strategies to manage cancer-related fatigue in adults. Secondly, we'll talk about methods of communicating strategies to manage fatigue with clinical team members, patients, and caregivers. And third, I will guide you from a selection of evidence-based strategies to manage cancer-related fatigue that are included in guidelines. So first, let's talk about the definition and screening for cancer-related fatigue. This definition is by the NCCN guidelines, and this version, as you can see, is from 2021. We have had this definition for many years, and it seems to capture the sensation of fatigue very, very well. Cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness to exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. So one point I want to make here, it is not the same fatigue that you feel at the end of a long day. It is related to cancer and cancer treatment. It is the most common symptom reported by patients with cancer. Up to 90% of patients will record significant fatigue during their cancer journey. So therefore, we need to screen every patient for fatigue at regular intervals, and we do it on a severity scale. Now, we know you also have frequency, and that matters a lot, and so does distress, but we want to ask you about your severity. And whether you're a patient or a caregiver or a clinician, we want you to always think about this on a 0 to 10 scale. 0 equals none, and we believe that ratings of 1, 2, and 3 can be managed with general principles of fatigue. When it becomes moderate and people report a severity of 4, 5, or 6, we need to do more and try to help them manage their fatigue with other techniques or other strategies. And finally, severe fatigue is fatigue that is rated 7 to 10, with 10 defined as the worst that you can imagine. And we certainly hope that as clinicians, we can bring your fatigue down and you won't experience the worst fatigue you can imagine. So let's talk about the role of the clinician providers in teaching patients. And I've underlined this top point to really make a statement here. The oncology team's role is to teach patients and caregivers about evidence-based symptom management resources. So I've given you 2 of the very best examples. You may have other examples, but we want to be sure you're going to reliable and valued sources. And I know many people will try to help you and give you advice about ideas they have, but I've included these websites and you will be able to access the slides afterwards. But if you Google the National Cancer Institute and then side effects fatigue, you should be able to get to this site without any trouble. And one of the nice things about the National Cancer Institute, they have a version for both the patient and the health professional. The group that I have been the team captain of since 2008 is the National Comprehensive Cancer Network. And as you can see, it has the professional version here at this website, but it is written so professionals can talk to patients and caregivers. So it is very user-friendly. And so I want to emphasize that the team is responsible to assist all patients and caregivers to learn and to gain understanding to apply this information. The journey that you're on will take considerable amounts of your time and energy, and we want to help you manage fatigue. So the NCCN provides what we call standards of care for cancer-related fatigue. And these guidelines are to be implemented worldwide and certainly throughout the United States. And being in a city like Omaha, Nebraska, we have many, many fine clinicians that do deliver high quality care. And these should be expectations for the care that's delivered. So first of all, I referred to this before, patients should be screened for multiple symptoms using self-report and other data. And you'll notice I put that little star behind the word multiple, and that's because fatigue is the most common symptom, but it doesn't usually come alone. Many patients will report pain or anxiety or sleep disturbances or perhaps nausea or vomiting. And so you will be screened for more than fatigue, and that's really important so we can help you figure out the best intervention. Secondly, cancer-related fatigue should be managed according to these guidelines. And I've emphasized that before. So I notice when I pick up lay magazines, there's almost always an article about how to manage fatigue, and it might be for healthy people or for people now that we're going into summer that want to get out and be more active. And those are not the guidelines for you. These are the guidelines for patients with cancer. And patients and caregivers should be informed that managing fatigue is an integral or an important part of your care. It's not an add-on or extra, and you have every right to ask about it. And the team approach is best to tailor the interventions to the needs of the individual patient. So I wish I could say that there's one thing that would work for all of you, but a lot will depend on the type of cancer you have, the type of treatment you're receiving, the stage of the cancer, and other symptoms that you're having. So we need to consider referrals. And by that, I mean like to the physical therapist or the pharmacist or to a psychologist. And the team needs to be using ongoing education and training as well, so that your clinicians deliver the care that is the most up to date. So how are we going to communicate between the healthcare team and the patient and the family? And I put on the top there on the header, in person and virtual, because obviously during the last year, we've had opportunities to do more virtual than before. And I think you'll see more examples of this, and I'll be giving you some examples. So the first thing is communication between clinicians and patients is a two-way street. And it's challenging in stressful situations. You know, time is really important. People don't want to bother clinicians. Clinicians want to talk about the cancer and the treatment. So often fatigue will be not brought up, but you have every right to bring it up. It's a two-way street. Clinicians need to assess the patient and the caregiver's ability to read, to speak, to hear, and to understand English, and then accommodate for those needs. So many times patients will tell me as a nurse, the clinician just spoke so fast and they use words I don't understand and I don't really know what they told me. And then they feel embarrassed to ask again and go home and try to understand what, they don't even know how to look it up because they don't know how to even spell it, for example. So I included this quote. You've all heard this as you've gone through life. We probably only recall about 10% of what we read, 20% of what we hear, 30% of what we see, 50% of what we see and hear. So that's like an in-person visit, 70% of what we discuss with others. So I encourage you to discuss what your issues are with your clinicians. 80% of what we experience, remember the majority of people are going to experience fatigue, and so they're going to be qualified to talk about it. And then 90% of what we teach others. So sometimes by talking to your family members and teaching them about your fatigue, you yourself will be reinforced. So communicating and understanding managing fatigue, there's many ways to work together, that two-way street. First of all, clinicians can share online, evidence-based, reliable sources. So I've just given you the National Cancer Institute and the NCCN organization, and they are evidence-based, reliable sources. And when I use the word evidence-based, by that I mean that there have been research studies, and we've heard a lot about this during the COVID epidemic, that have demonstrated that they are effective in helping people relieve their fatigue. These are not things that have no evidence to go with them. A phone call. So the patient and the caregiver can call in to discuss with the clinicians. Sometimes the phone call is returned quickly. Other times you're encouraged to be patient with that. But now through the OneChart portal and through email, through other means as well as OneChart, there can be two-way exchange of information that's not dependent on timing. So if you haven't used your OneChart portal to talk to a clinician, I would encourage that. Then we have text messaging by phone. And just to remember, that's for basic information like questions and answers, and limited use for any teaching or understanding. In the example I came up with today was a patient could text their clinician and say, "Can I go in a hot tub?" And the answer might be, "No, you have a port, and a port cannot be submerged underwater." So that would be the type of thing you could ask. And then classes to support the patients and to practice the strategies to manage fatigue. And I know that's what most of you are interested in. So now I'm going to give you some general strategies for managing fatigue. And if you go to the NCCN website, you will have to have a username and a password, but I'm sure you do that for many things. This is what's on the page called FT5. And that is that the patient and the caregiver education and counseling. The first thing is to know your patterns of fatigue during and after treatment. So are mornings better? Are evenings better? Are the days that you get your treatment the next day the worst and it gets gradually better? Because the more you understand the patterns, then you can plan your life, right? And not have it interfere with your quality of life. And I want to reassure you, and this is what you should be taught, that treatment-related fatigue is not an indicator that the cancer has spread. So if someone has a treatment and says, "I feel worse, I don't think that this treatment's working, it must be the cancer spreading," that is not true. Some of these treatments are very fatiguing. Patients know that they can initiate and maintain physical activity. And you can see on this slide, I put the Y. I'm going to be telling you more about Live Strong at the Y, which is one of the best programs that is nationally implemented, and we can do that here in Omaha, Nebraska. So if you do not have a regular physical activity pattern, that's something the clinician will talk to you about. And then learn to self-monitor your fatigue levels. So remember when I gave you the 0 to 10 scale, you're going to have to use energy conservation when you have high ratings. So if you wake up in the morning and you say, "I feel like I'm a 7 or an 8, you're obviously going to pick the priority things to do that day and pace yourself and delegate. "Can you help by going to the grocery store for me? I just can't go to the grocery store today," but maybe you could have gone when it was a rating of 3 or even 4. And then labor-saving devices. Try not to do things the hard way, the way you've always done, but instead to figure out ways to save energy. And one example is like in a shower, to have a shower chair there. Postpone non-essential activities and limit naps and structure day routine and review meds. So that's quite a few things, and I know you're going to have to think about them. But one thing I really want to emphasize here is that you did not see here it said to rest. So around the year 2000, we used to tell our patients to rest, and that would help them with their fatigue. And that is not the evidence anymore, and we do not encourage people to spend the majority of their day resting, thinking that fatigue will go away. So if you have a rating that is going up, we know we need to do a focused history and assessment. And this assessment is done by the clinician. And we will look at your disease status, the treatment you're currently receiving or past treatment, and any recent hospitalizations. And as you know, a hospitalization can really, we'll call it, wipe you out and make you very fatigued. What medications are you on right now? What side effects do they have? And are there interactions in them that by adding a new medication, it's actually causing an effect of the meds you were already on? And then looking at your fatigue history is in depth. So when did it start? What are the patterns? How long does it last? Have there been recent changes in your fatigue? And more importantly, have there been recent changes in your physical functioning? So can you go to work? Can you go to the grocery store? Can you go to the things that matter most to you, such as a social activity or a spiritual activity? And then assess treatable contributing factors. So I want to emphasize that those other symptoms like pain and emotional distress, anemia, sleep problems, nutrition changes, weight changes, fluid, particularly dehydration, and a change in activity level are all things that we need to understand so that we can help you pick the right intervention. And then finally, look at your comorbidities. What other diseases do you have and do you are treated, such as high blood pressure? And have you had a recent infection? And is there any current or past alcohol or drug abuse that may be contributing to the fatigue? So now we're into the interventions. And remember, I gave the cutoff of 4 and higher. So if the patient rates the fatigue as 4 or higher, select from evidence-based strategies to manage that fatigue. So on the NCCN guidelines on this page 6, they really emphasize, and our research separates them into people on active treatment and then post-treatment. So category 1 here, you can see this little star. It's a relatively short list of what we call non-pharmacologic, non-drug interventions. And as Americans, we would love to take that energy pill, right? And just take the pill and feel better and say, oh, my fatigue is a 1. But I want to emphasize that the non-pharmacological interventions are the ones we would help you select from. So physical activity is the one with the most evidence. And particularly if you're not physically active at this time, we would work with someone that would help you design a program that is right for you. Yoga has been shown to be helpful to patients during treatment. Massage has. And then some techniques that many of you may not be familiar with called cognitive behavioral therapy that's delivered by at least a master's prepared therapist or perhaps a psychologist. And they have programs from the American Psychiatric Association for fatigue and for sleep. And so if these problems become persistent, those may help you. And then we have psychoeducational therapy. So that's attending a class. Sometimes it teaches you more about your cancer and your cancer treatment. And by helping you get the education, it relieves your anxiety. And we do know that anxiety drives a lot of the symptoms. So we want to try to help that be lowered. Pharmacologic, the only recommendations are to treat for pain, emotional distress, and anemia as indicated per the guidelines for supportive care. And I want to emphasize that OTC, that stands for over the counter. There are no over the counter medications, we'll call them, or additives that have been shown to relieve fatigue. So please don't spend your money buying things that are advertised that are not shown to be evidence-based. Then this is the same slide, but post-treatment, and it's on the following page of the guidelines, FT7. And the category 1 evidence, many of the interventions are the same, but there are a few more. And that's a good way to think about it, that during treatment, you're going to be probably more limited, but post-treatment, you may be able to get out and to do more than you were able to during the treatment. So physical activity is still the intervention post-treatment with the most evidence. So I strongly encourage you to think about Live Strong at the Y if you have not done that before, or a program where you do get help with your activity plan. But here again, whatever the gym company that might be closest to your home, unless those exercise therapists there have had training in helping people with cancer, those are not the programs you want to be on. Yoga, again, psychosocial interventions like support groups, the cognitive behavior therapy that I talked about before fatigue or sleep, but mindfulness-based stress reduction. And I will say that in the last few years, mindfulness-based stress reduction has been shown with strong evidence to really help people because it works on your mind of helping you relax more, as well as yoga type interventions. It's kind of a combined of the activity and the psychological. And then psychoeducation therapies. And I want to be sure people know about A Time to Heal, and they will have a survivorship. It will be starting on June 1st, and it's Survivorship 101, and it is going to be done remote via Zoom for 8 weeks starting June 1st. Time to Heal is a very evidence-based program that might be helpful to you. And then we call them supportive expressive therapies. So ways that you can be part of a group that helps you express your feelings. And then finally, on the pharmacological, once again, we need to be sure that your pain and your distress and your anemia are being treated with medication. And this would certainly, under emotional distress, we talk about anxiety and depression per the guidelines, but no over the counter. And talk to your clinicians if you feel that you need help in this area. So to summarize then, fatigue is complex. I'm sure that you have thought about that as I've been talking, with many possible causes to consider. It's not something we quickly have one answer to. And it's important for clinicians to assess its presence and its severity. And think about it as a vital sign. We always check your heart rate or your blood pressure, and we should always check your fatigue level and your pain level and perhaps other symptoms. And that team that includes the patient needs to select individualized strategies and plan to lower fatigue levels. And once you have a plan, patients and caregivers can feel in control over their fatigue and practice strategies every day. It may take some time. Most behaviors take 8 to 12 weeks to really benefit from them. But I believe that by trying them, you can meet success. And obviously, I haven't said anything, but we have many, many people now living with metastatic cancer, cancer that's spread. And I want to emphasize that it's very important that, as I've put on this slide, that any strategy you select would be individualized and that you would work with clinicians to make sure it's safe for you. So at this time, I'd like to open it up for questions. If you haven't gone to the chat room yet, then please do. And I'd be happy to try to assist you in helping you identify ways to manage fatigue. Thank you very much.